Over to you.
Okay, thank you, Kimmy. Well, some of the breaking news this morning is that Target has announced that it is not going to be providing health care insurance for its employees any longer, for its part-time employees at least. Our insurance expert Craig Gusson joins us here this morning to talk about that. Just the latest company to announce this, that they're not going to offer this insurance any longer, and they're telling folks, you know what, just go to the health care exchange and do the best you can.
So what they did, because I read that this morning also, they're giving all the part-time employees $500 a year, and that'll help pay for the health insurance. It's for part-time. It sort of makes sense. It's just a cost of doing business. You know, the retail industry is not making a lot of money. The profit level is so small to be competitive. So that makes sense. A lot of businesses are doing it. We saw Trader Joe's do it. We saw...
But they didn't start doing it until healthcare reform kicked in. So is it a good thing or a bad thing?
Well, I think it's a bad thing for one thing, because if you work for a company and they're paying some of your health insurance, you're working part-time, you're paying with pre-tax dollars.
Okay.
Now you're having to pay it all with after-tax. So it's a big difference. You're looking at anywhere from 15 to 25% more in
real dollars that are coming out of your...
And that's why I have it. But I understand why the businesses are doing it.
Okay. That being said, what's the top question that you're getting here this week?
Top question is, why have I been on the phone 3 hours with the insurance company? And I was at a meeting last week, and Blue Cross told us that in a 2-day period, they received 1 million phone calls. So, and I was moderating a panel of all the insurance companies. And I said, is this pretty common? And all the companies said yes. So the problem is, and I was looking at my numbers last night, I've done more business in the last 2.5 months than I've done in the last 12 months. So when you have that much business, and I'm one agent, if you multiply that over the state, plus people going on themselves, the insurance companies have done more business in the last 2.5 to 3 months than they've done in the last 12 to 15 months. And they have 10,000 people answering phones, and they still can't answer them all. So,
well, let's talk about who's actually signing up right now for health care, because the latest numbers that have just come out in the last day or two are that the vast majority of people are not the folks that were previously uninsured.
No.
So there's millions of people that this promise to get those folks that were uninsured on health care, they're not even signing up.
No. What's happening is, and I'm waiting to see the numbers, but they're saying, hey, we signed up 4 million people. Well, how many of those 4 million people had health insurance December 31st? I'm guessing 80%. So I don't think that number, or maybe 90% of that uninsured, is really jumping in. The ones that are jumping in are the people who were unhealthy and really wanted coverage or got subsidies.
And young people aren't biting on this at all.
No. It's a
and they were the ones that you needed them to pay premiums for a service that they essentially it's really insurance for them. It's something that they will probably not need, hopefully they won't need. But they're willing to take that gamble, so they're not signing up.
And that's exactly the point. If they weren't signing up before when the premiums were lower, what's going to force them to sign up when they got to pay a $95 penalty?
Craig, we talked about this week after week after week. What's the next deadline that's coming up that's going to let us know this either is getting better or it's not working and it's time for the government to admit it and do something else?
Well, here's what's going to happen. You have to buy your health insurance by March 31st.
March 31st. That's the next magic date?
Next magic date.
Okay.
Are they going to prolong that? I don't really think so, because the insurance companies are just saying, wait a minute, we can't keep doing this, because if you just don't have a cutoff period, people are going to buy it whenever they want, and then the way they projected the numbers and costs isn't going to work. Because right now, if you don't buy it by March 31st, you can't buy it till January 2015.
And they're going to have to then go back and look at these numbers, the insurance companies, see who signed up, see what the risk pool is, and then set their rates for the coming year. And if they find out that the only people that signed up were people with pre-existing conditions, people that had been canceled before, and the young people didn't sign up, will rates not skyrocket at that point?
It's funny.
Will they not have to raise that?
That was the exact question I asked the panel of insurance companies, this question. I said, do you have any idea what your rates are going to be next year? And they said, we have no idea, because we have no idea what the mix is going to look like and how many people actually sign up. And what they're concerned is that the only people signing up are the people who are unhealthy, know they need a surgery, maybe they find out they're pregnant, they haven't had health insurance, and now they're going to get it. So these are the issues that we're dealing with, and they have no idea at all what the rates are going to be next year, and they're concerned about what it's going to look. And they said, we can't make rate predictions for probably another 6 months.
It's frightening, and yet
Yeah.
I don't think people even know to be frightened at this point because they're so confused.
Yep.
Let me ask you a quick question
Okay.
from Gary in Lakeside.
Okay.
There are layoffs at my job. If I get laid off after April 1st, do I go on COBRA, or can I get health insurance from Covered California? You have said the last day to buy health insurance is March 31st.
Right. What I find is that's a question that's asked to me a lot. So what happens is you get laid off from your job and you're going, well, what's my option? Well, how much was COBRA? If you said to me, hey, COBRA's going to cost me $200 a month and I have this $10 HMO plan, I'm going to say go with it. It's a good deal. But if you come back to me and say, you know, I'm Heather, I got a family of 4, they're going to charge me $1,200 a month, but I was only paying $200 before, the other $1,000 the insurance company, your employer was paying for you. So now you're paying $1,200 a month and you're going, I can't afford it. So then we can come in and look at what it would cost you outside of COBRA. So it's really going to be your choice. You can go on COBRA, or I can get you coverage whenever you want because it's a qualifying event.
Oh, it's a qualifying event. That's the key.
Yes.
Okay, Sandy in Hamul says, I'm going to have a baby in May. Can I add a baby to our current health insurance plan? You said many times that you can't buy health insurance after April 1st. What do I do?
Seems like the theme is that.
Right.
Yes, that is also a qualifying event where anytime you have a baby, you can automatically add the baby to your plan, or maybe you get the baby its own plan because you want the baby to have better coverage, because anybody with small kids know the kids are in the doctor a lot. So maybe mom and dad have like a $5,000 deductible and they want a much lower deductible for the baby.
Okay, very good. Craig Gusson, our insurance expert. It's always good to see you.
Good to see you.
Again, as we approach some of these deadlines and so forth, I think we're going to get more information, but I don't know when we're going to get enough to see the government start making some adjustments here other than just extending deadlines.
It depends on who signs up and who doesn't and what it looks like the next 30 days.
Okay. Craig Gusson, thank you so much.